Hello, everybody. Andrea Twarowski here with Dentalelle Tutoring. First, I want to say thank you so much for all loving the videos. I am so happy that everybody does. And if you have any comments, please just let me know because I do read all of them and I make sure to say hello back. So please just let me know. And this video is actually inspired by a comment. She had asked, how do you have conversations with your patients, especially if you're a very shy, type of person? And this is a great thing to talk about because even if you're not shy, it's easy to just kind of run out of things to talk about, and you want to always sound like you're a professional. You would like to sound like you're having a good time, even if you're having to wait a half an hour for a check, which happens. You just have to come up with something to talk about, right? But that's easier for some people than others, especially when you're just starting out. It's very easy to just be like, la-di-da, what do I do? I'm new here. I don't know what to talk about. Do I set up? Do I not set up? Now, everybody's a little bit different on this, but I get not annoyed, that's not the right word, but when I see other people in my office, either the dental hygienist or the dental assistant, who have simply just left their patient waiting in the room and they're cleaning up something else, they're setting up something else, they're socializing with their coworkers, they're in the lunchroom, they're sterilizing instruments, they're doing everything else but with their patients. Now, I do understand that if you're a half an hour behind, you may have to leave the room for a couple minutes to set up for your next patient. I have done that too. I totally understand. Or if you're seeing two patients at once because you're cleaning teeth and then the dentist wants to smooth a filling, but then you have to seat an emerged patient in the next room, but then you have to start your cleaning on somebody else. I totally understand that there are situations where you just simply can't stay in the room the whole time. But I'm not talking about those situations. I'm talking about when you actually can stay in the room and talk to the patient and wait with the patient until the dentist comes. So I'm just kind of talking when you're waiting for a dentist to come in for a check. You have to make conversation. Or even when you're just new at this whole thing and you don't know what to talk about, you don't know what to say. Now, you don't have to talk the whole time either. Like, let's say you're cleaning somebody's teeth. Don't feel like you have to talk the whole time, because even I don't talk the whole time. It depends on, who I'm talking to, right? Like, if I can tell that my patient likes to talk, then I will talk the whole time, while I'm cleaning their teeth so that I can still get some work done. If I see a patient who, as soon as I see them, I ask if there's any changes in their health, if there are any tooth issues, any sore teeth, and they just say, no. Then I can tell they're a little bit shy or they just simply don't want to talk. I usually get a pretty good idea too when I see them and I say something like, so how are you so far this afternoon? How is the weather outside? Did you just recently come from work? And if they say, no, oh, it's fine. Yeah, thanks. Then I can tell that they're not in the mood to talk. But then for those patients who are like, oh my God, it is so nice outside. Like, I did all of my Christmas shopping and it's November and I just got off of work, or I have the whole day off. It has been so nice. If I can tell that they like to talk, then I will keep on talking. I'll say something like, oh yeah, like I put my snow tires on a month ago, but I didn't actually have to use them. How do you feel about snow tires? Like, you just make conversation. But you also have to keep in mind too that you still have to get the work done. So what I'll do is I will, talk to them initially. I will say, okay, well now I'm going to sit you back. I'll put something on the TV for you, and let's make sure that those teeth are nice and smooth and shiny, But I will also talk to them about what's inside their mouth. So as I'm cleaning, I'll say something like, oh, you have a little more stain on your 6s and 7s today, more than usual. Have you been drinking more coffee? Have you been drinking more tea? And then, they will answer your question. I'll say something like, you have a lot less plaque on your lower front teeth on the inside than you normally have. That is awesome. Keep up the good work. Are you using a new toothpaste? Are you using a new flossing technique? Like, what are you doing differently because things do look a lot nicer than last time. You know, so as I'm cleaning, I do try to, you know, still not talk their ear off and talk about the weather and talk about the snow and talk about the lack of snow, talk about my holidays. I will actually talk to them about what's inside their mouth. So then that way the whole time they know what's inside their mouth. So then at the end of the appointment, I can say something like, yeah, so things looked pretty good today overall, but you still have to focus on those molars in the back. On the inside, you had a little more plaque there than usual. Sometimes I find if you just brush those teeth a little bit longer, that seems to help and make all the difference. I might say, you know, you had a lot more bleeding than usual today. Please remember to keep up with the brushing twice a day and make sure to floss every single day, even if you're watching a movie or TV. You know, if you're sitting there anyway, take out the floss, and then hopefully the next time I see you, the bleeding will be a lot less. So I do always try to talk to them about their oral hygiene, but never make it sound like a horrible thing. Like, okay, Mr. Smith, you're still not flossing. Things were ew in there. Things were disgusting. Oh my gosh, never ever say that. I always try to find something good. Even if there's nothing there, even if there's nothing good about their oral hygiene, if it looks horrible. Say something like, you know what, thank you so much for coming in for your cleaning today. You know, that's a nice thing to say. You needed a good cleaning because there's still a lot of plaque and tartar in there, but things look awesome now. You are off to a good start. Hopefully next time things will look even better. You know, so even if their mouth is horrible, come up with something like that. Like, well, now your teeth are nice and clean. You are off to a great start. You know, to keep things nice and clean, now is a good time to start to brush twice a day, every day. Floss every day, and then the next time I see you, things will look awesome and I'll be so happy, you know. Always come up with something. Always think of something. But what you may be wondering is, what if you're waiting for a check and the dentist is keeping you waiting for like a half an hour, and you're thinking, what else can I talk about my patients with? So first, again, always talk about their oral hygiene. You know, ask them questions. Say, oh, you know, I'm just curious, do you use an electric toothbrush? If they say yes, ask them the type they're using, ask them how long they've been using it for, share your own experience with using an electric toothbrush. Like I have said often, oh, you know, I like Sonicare the most because I find that the brush head's a little bit larger. I have larger teeth, so I need something like that. You know, have you ever tried the Oral-B? It is awesome too, but I just found the brush head was a little bit too small, you know, so I will talk to them about things like that. I tend to just say things like, oh, so do you have to work after this? And then we end up talking about their work, and then I will sort of say something like, yeah, you know, you work the night shift. I've never had to do that, and I am happy that working here, I don't have to, because I don't know if that's something that I'd be able to do. How long have you been working the night shift? You know, so just always come up with something else to talk about depending on how they start the conversation. If they say to you, oh, well, I have the whole day off, I will say something like, oh, well, what sort of plans do you have? Because I know when I have the day off, I tend to get through all of my appointments. I might be cleaning the house, doing the laundry. So is it a day off? Well, not really, but that's the only time that I have to do all of those things. So I will just constantly just ask them questions, and then depending on how they answer me back, it's, you know, easy. I am getting married in about a year, so I will talk to them about that. Like I'll say something like, oh, you know, on my last day off, I was looking at things for my wedding. I had no idea how expensive things were, you know, and then they may say something like, oh yeah, weddings are expensive. When I had my wedding 20 years ago, this is how much it was, or, you know, whatever. So just play on to things that they talk about too. So Those are just kind of the main things that I talk about. Honestly, I talk about the weather. I talk about their oral hygiene. I talk about their current oral hygiene habits. I will talk about what's happening with me and then just see if they're interested. I may say something like, oh yeah, I've been doing this now for 13 years and how technology has come a long, long way, you know, hasn't it? Like if the dentist told me that I had to take an x-ray, that's how I would start the conversation if I knew that I would have to wait for a check, you know. If I pull up the x-ray and say, hey, well, since the dentist isn't here yet, let's have a look at the x-ray. This is the picture of the tooth I took. He will check to see if there's an infection around the apex. This is the apex here. So even another thing is if you took x-rays, talk about the x-rays, you know, say like, this is the nerve of the tooth. I'm not sure if anybody's ever shown you the x-rays before, but we have time. So let's talk about the x-rays, and always ask if they have questions. Because I find a lot of patients do have questions, even if they're a child, a teenager, it doesn't matter, but they have questions, but they may not know how to ask the question, right? So just always ask, do you have any questions? Because since we have to wait for the dentist anyway, now is the time to ask, now is the time to talk about it. And even as you're waiting, book the next appointment, because that will make the ladies up at the front so happy. You're booking the next appointment, so the patient's looking at you saying like, oh wow, like you can book appointments now, like that's awesome. Make sure to give them a new toothbrush, you know, floss, just carry on the conversation, book the next appointment, book the next 2 appointments. If you feel that they should be coming in for additional cleanings every, say, 3 months instead of every 6 months, talk to them about that. Show them pictures of perio, show them pictures of gingivitis. You know, there's lots of things to talk about. I think it just depends on your patient. And if they're a talker, if they're not, if they're shy, just don't even bother. I mean, I'm not saying don't bother. Talk to them, but don't feel bad if they don't really answer you back. Yeah, those are just kind of the main things. So I do hope that this helped for that person who wanted to know sort of how to start a conversation with your patients. I do hope this helped, because I talk to my patients a lot, probably way too much, but it's because I love what I do and I like to talk. So anyways, I do hope this helped, but please just let me know if this isn't exactly what you were looking for, and then I will make another video to help you out. So once again, this was Andrea Twarowski with Dentalelle Tutoring, and I hope that this helped. See you later.